I'm Dr. Bret Dyer. I'm a periodontist in Sugar Land, Texas. Our practice is Fort Bend Periodontics and Implantology. As a general dentist, you can do all fields of dentistry. You're not really limited to anything, but the strength and weakness of that is you get a good comprehensive knowledge. The weakness of that is you're not typically in the cutting edge of any of those fields. So for doing fillings and crowns and normal day-to-day stuff, being a general dentist is great. But the advantage of a specialist, someone like me, is I know all about the techniques for growing back bone, or for growing back soft tissue, or for restoring basically the ability to take a patient who's had some type of loss, whether it's trauma, whether it's infection, and you've lost gum height, or you've lost bone or teeth. I have the training, the technology, and the expertise to deliver a type of care that's a step above what you would get at a general dentist office. Typically, it's when the things that send patients to me most frequently. A patient looks in the mirror and they've noticed that their gums have started to recede. This happens a lot. This morning, it happened to a gentleman who he's had one child. He's about to have another, and he's noticed in between the two children that all of a sudden his gums are starting to recede. So he's been a little worried. He's been clenching and grinding his teeth, and when he looks in the mirror, he can see the necks of his teeth and now the roots of his teeth. And so someone like me, that's not a big challenge to correct. I can correct the underlying cause, and we can repair the damage to it. Other things that patients come in to see us frequently for are gum disease. So I'm a periodontist, and so I'm a specialist in gum disease and dental implants. And so in a traditional dental office, a general dentist office, if you have gum disease, they'll do deep cleaning around your teeth and try to get a mild case of gum disease under control. Some of them even use early forms of lasers, the diode laser, to treat early forms of gum disease, but they don't typically have the expertise and the technology to repair advanced bone loss or even moderate bone loss. And so if you've noticed that your gums are receding, but also maybe your teeth are loose, or maybe you have bleeding around your gums are bleeding a little bit, or you have a family history of gum disease, or you have heart disease or diabetes. All those things tend to predispose someone to having gum disease as well as those diseases. And someone like me can restore the gums back to health and actually lower the risk of heart disease and decreased blood sugar in a patient with diabetes. So coming to someone who has that level of treatment available to you is something that can really not just affect your teeth and your gums, but your overall health. It starts off as it does in every office with a doctor and a patient. We try to get to learn our patients' concerns and their needs and their desires. But when you start with me, at least in this practice, our goal is not only to get you healthy again, but it's actually to keep you that way. And so I have lots of patients that have been with me for 10 and 20 years, and so they become a friend of the practice or a friend of the family. I've seen patients grow up, and I've seen patients age, and have taken care of them through the whole process. Today, you do have a lot of choice. There's a lot of corporate dental offices in America today, and especially in Houston, the greater Houston area, and a lot of traditional insurance practices, and they tend to be limited by the insurance plan. They offer you just what insurance will pay for, and so you get treatments like traditional osseous surgery. It's been on the market. People have been practicing it since 1949, and it hasn't changed a great deal. And so today, still the most common surgery you would get in a periodontist office is osseous surgery with a scalpel, and you end up with gum recession, you end up with tender teeth, longer teeth. There are true advantages to having treatment done with modern techniques in a minimally invasive format And on top of that, it's not any more expensive than you would get if you went to your practice. It's an all insurance practice. And in fact, we take all insurances. But we have this technology, we have this expertise to make this experience where it's not something that you're going to dread before, during, and after.